Hi, this is Dr. Paul, and thank you so much for tuning into this video from Waterfront Dentistry by Paul's. Today, I'd like to talk to you about your treatment options, especially when a tooth or a bunch of teeth are taken out or extracted. Back in the day, we used to take out, a tooth or a few teeth and tell the patient, look, give it 3 to 6 months, everything should heal, and then when you're ready for your options, whether it be implants or partial dentures, let us know. Now the problem with this is, with research and with studies, we've figured out that when a tooth is pulled, within 3 to 6 months, you actually get 80% of bone loss. Now this is significant because if you want to get a bridge or an implant, the amount of bone that's missing affects the long-term prognosis of the treatment modality. And this is the reason why this day and age, when we pull a tooth or a bunch of teeth out, we give the patient a few options. So option number one is we don't do anything to replace that area, which is the healing socket in there. And we tell the patient, look, if you don't want us to put anything in there, you just need to know that you will lose quite a bit of bony housing. And it doesn't happen to everyone, but it does happen to quite a few people. And that narrows your treatment options in the future as far as cost and predictability goes. The second thing we do is, or we offer is, we pull the tooth out and we give you something called allograft or cadaver bone. Now the advantage of cadaver bone is within 3 months that bone takes and becomes hard, and then the patient can get an implant in there. So say you get a patient that comes in, doesn't know that that tooth is terminal, we got to pull the tooth out, so we give them that option of pulling the tooth out and giving this patient some bone grafting. Now, if the patient says, look, I don't really want an implant at the day off and I just want to think about it, the allograft usually buys the person a year or two before even the allograft slowly starts resorbing. The third option is xenograft or bovine bone. So the advantage with bovine bone is it sticks around for 8 to 9 years. Disadvantages for the first year, it doesn't really quite take. So if the person says within a year, I want an implant in this extraction socket that you put bovine bone, the answer is no. You got to wait for at least a little more than a year. But within 9 years, we can still place the implant in there. Now, the timelines of implant placement is very important. When a tooth is terminal and a tooth needs to be extracted, if your dentist has access to a CBCT or a cone beam CT and they see that you have enough bone in there, we can actually negate or take out 3 months from the equation by seeing if we can take out the tooth atraumatically or with as minimal trauma as possible, and then lodge the implant into the amount of bone that's accessible and get primary stability. And what that means in a nutshell is the implant is torqued into that part of bone and gives you 35 newtons per centimeter of torque value. So when an implant is placed on day one, it's actually the most stable. After a month, that implant now becomes the most weak, because after a month, the bone right around the implant starts resorbing and remodeling. Now from month 1 to month 3, which is 2 months, the bone reforms, remodels, and now the implant osseointegrates, which means the implant now gets ankylosed or solidified with bone, and now the implant is the strongest. So in the 3rd month, we do a couple of tests with something called RFA, which is resonance frequency assessment, or Ostel, and once the implant has a certain number, we actually say, okay, the implant is good to be loaded. So when you pull a tooth out, if you can place an implant in at the same time, you actually save the person 3 months. But if that's not possible, maybe there's a big infection in there, maybe the person just doesn't know if he wants an implant in, the timeline goes like this. You pull the tooth out, you place the bone graft in there, within 3 months, you can place an implant. You got to wait for another 3 months after the implant takes to now load the implant. Now, this is really important because if you're in a bit of a time crunch and you expect that an implant can be loaded within a week, that doesn't really happen. It can be temporized, which means an implant can be placed and the implant can hold a temporary crown so that it'll look like you have a tooth there and it'll feel to your tongue like you have a tooth there, but it should not be in bite. That's good. That can be done. This is the advantage with this kind of setup, is your soft tissue, your gums will learn to live around the temporary crown that you're placed, and that way you will have the best possible aesthetic or visual outcome. So that's very important for you to realize that implants come along with its own set of timelines that needs to be honored, just because you can't really accelerate biology. I hope this has made sense. Now, if you have any questions or if you just have any comments or concerns, you can always reach out to me or my staff, and we'd love to help you. Thanks for watching.